ahead of schedule. Just stay up there and talk to him.
We'll just treat this like possum. All right, everybody sit down. No, let's stand up.
All right, say the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll make a motion to approve the minutes and agenda as presented.
I'll second.
A motion Derby and a second from Smith to approve the minutes and agenda that I don't have.
Oh,
All in favor, say aye.
aye.
Aye. Just going off the cuff. You didn't have an agenda. Well, as long as he's in there, I should have grabbed Chris. Did you grab Chris?
She's here right now.
Well, she's not here.
She had a doctor's appointment this morning.
Okay.
Okay, auditor's office will discuss drainage matters, and she's not here. Anybody else got anything for drainage?
Nope.
Okay,
I think drainage hasn't. Weren't we supposed to be doing the canvassing of the elections?
We're gonna do it next week.
Okay, she wasn't quite ready.
We had a lot of people out sick.
I imagine. I did it sick for our election.
all right, so for Scott, I gotta pick the thing up, right?
Yes.
Is it 7530?
Yeah.
We're ready for you. Yep. Okay, well, we're waiting for Scott. Was there anything for open forum that wasn't gonna take too long?
So these are all received.
Sorry. There goes January.
Morning, gentlemen.
Morning.
What do you got for us today?
Okay, we have hired somebody for the Buffalo shop. Riley Sabin's his name. He lives in Buffalo Center. And he's been working for Osmus lately, but worked on the road for Michaels for about 1.5 years doing underground work for them. So he's got some good experience, quite a few hours in a machine for a younger guy. He'll start a week from tomorrow.
Doesn't seem like he's been out of high school level.
Yeah, I know what you mean. He, a couple years ago. So we're excited to have him start here. And the weather's kind of been easy on us while we've got our vacancy. At least
Looks like it's gonna be that way for a while too, isn't it? I don't think there's chances of snow coming up.
There's small chances, it looks like.
Supposed to warm up a little too. Suppose the warming up might be worse, make things icy.
More flexibility on what we can try to do, maybe. And then, letting you know that we have been working on our plow equipment quote for that truck chassis we bought. This would be equipment for next year's budget, but with the lead time, something we'd like to get moving on. So we got a Henderson plow equipment quote from Don's Truck Centers in Fairbank. We've gotten trucks from them in the past and had them do some upfitting and stuff for us before. Is it Monroe that's got this terrible lead time? Yeah. So we've gotten Monroe quotes from Steel in a lot of years, and they've done most of the upfitting for our trucks. Well, they're
480 days out on the power equipment. I'm getting it, that's not getting in the shop, get it outfitted, so. It's a timely way to go with Monroe, I guess.
yeah, so we're gonna have just the one quote the way it looks. We've had some recent quotes to compare it to, so I think we'll be comfortable with the number, even though it's just one bid on it. Would have liked to have the one from Monroe, but not possible.
You're just lucky you don't have to buy transit buses. Buffett kind of bought up that whole market and controls everything.
So I think next year's budget, we had 170,000 planned for that. The quote I was looking at is 155, but it's got some add-ons and deduct options that we'll fine tune and get put together for hopefully next week's board meeting. And then Ethan's also working on trying to get a quote for a grader, and that's also another next year's budget thing.
That doesn't seem like as big of a lead time on them. Josh said their last one that came in was like 4 months. And I think they actually said they ordered extra this year, so they'd have some on hand. So some 140 all-wheel drives like what we've got. So I don't think that's going to be an issue there. Just trying to figure out between two of our machines which one the price on them, what trade in would cost, or what they're valued at, to figure out which one to get rid of.
On those, is the all-wheel drive, is it mechanical or is it hydraulic?
Hydraulic.
Hydraulic. I was gonna say, I can't ever remember seeing a drive shaft going to the front of any of them, so.
No, they're all hydraulic.
Is that something that's on all the time or
No,
just when it's needed?
just when it's needed. Wetter snow events, it's nice turning corners and obviously plowing deeper snow. Wouldn't go away from them, for sure.
I just know mechanical is a lot more power efficient as far as than hydraulic is. So usually hydraulic is just, it's not something you use all the time.
Right.
So see where we go on that, but 90 is not as timely of a decision being as the budget's not approved yet, but something that.
How many of our units are all-wheel drive? Remember? 5 or 6 on that many. I remember when we got our first one. It was
Yeah.
a lease return from Duluth or something.
Well, yeah, we have the 04s or 05s and 06s. 143s are all-wheel drives, and those came from Duluth used. We actually tried getting one from Duluth again, right, 6 months ago, and someone up in the city's gobbled them all up before Josh could get anything, so. We tried going that route again, but. So all our full-time plows are all-wheel drive, and then 2 of our winter routes are all-wheel drive also, so eventually after this one, we'd have all-wheel drives in all winter machines, other than our two standard ones.
And you are talking trade-in then,
Just, yeah, Josh will give me a price on it, and then we'll figure out
if it's worth it.
Whether you wanna sell it on your own or not.
Right. The last couple, he's given us really good comparable prices to what they're going for online, so we've gone that route, just trading with them.
So what kind of sticker shock is on a grader?
On the 450 on the last one?
Yeah.
So both the 170 and the 450 would be on next year's.
Right, those are the two main purchases for that one. We also pay the tractor lease and a few other odd things out of there, but that's the most of it. So yeah, after, I think 400,000 is what we had planned for, so hopefully with the new minus the trade, that's where we can get to.
The good news is the used ones kind of go up in value as the new ones do too, in a sense.
Kind of seem to level out about 75,000. It's like you see graders that have 15,000 hours, 10 years older than ours go for that. But then as we're looking at our oldest one compared to the 2010 one, value not as far apart as you'd hope.
Because you're getting to the point where, you know, for $350,000, you can make a lot of repairs to an old one and make it a pretty good machine.
Yeah.
Is the market stronger for the ones that are non-deaf or anything like that?
Well, that's what I'm trying to see with Josh on this. 2010, what we have is a joystick machine. It's got
Was it
similar hours to our 2001.
Is it 13 they changed it over to deaf, or what year? Trying to remember.
Well, it'd be everything we've gotten after that machine is deaf. Can't remember. The next one's a 15.
The way things are going at the administration, we may not have to worry about deaf anymore.
That'd be nice.
Yeah, we don't want that.
Yeah.
You know how good these engines would be right now if they didn't have all that computerized crap on them.
It definitely chokes them up compared with ones that don't have that.
There have been counties that have done some rebuilds, you know, full on rebuild. You can do that light or heavy. But
I think there's a place out in Sioux Falls you can take your truck in and they'll completely disassemble it and then replace everything that needs to be replaced, rust-wise and all that, and clean it all up, and when it's done it looks like a brand new truck and it costs way less than a brand new truck.
yeah.
You think,
You know, we've looked into it a little bit. We've talked about it a lot. There's a guy at Brown's Equipment at the County Engineers Conference, Maintenance Superintendent Conference that we talk to all the time.
They have different packages that you can go to. Is full rebuild engine transmission to just change hydraulic hoses to paint the whole machine to interior.
and the main thing is, you know, I mean, the machines themselves, you know, they maybe even have some advancements as they knew them, so, but you get to keep that old engine that doesn't have near the problems that, well, even back in 2012 when I overhauled the engine in my truck, which was built in July of 92, an engine in 2012 was 80% more likely to have a major failure in the first year. They didn't last as long. They cost more up front and they're higher maintenance. Other than that, they're great engines.
I think part of it is, do we take the whatever machine pukes out first and has a major transmission or engine trouble and then send it off to get rebuilt? Are we sending the 2001 machine down for complete rebuild so we can have it another 15 to 20 years? You know, or do we want to have 45-year-old machines maybe.
Well, if the complete rebuild includes completely rewiring them, maybe.
It does.
Because you're gonna reuse that old wiring. I mean, that's where the older things get with all this wiring on them, that you start to have resistant issues and junction boxes and all kinds of stuff. So,
I think a lot of times we talk about rebuilds in like a quarry setting where you got these pretty new machines with 10 to 20,000 hours on them. We really don't get that kind of hours on like a quarry would.
mhm.
What machine is worth putting that kind of money into? We haven't maybe found what we thought was the right fit.
Yeah, I feel like we have wiring harness problems with our new machines just as much as, so if you spend all that money to get it rebuilt from the wheels up, you're gonna have wiring harness issues in the first couple of years again.
I think we've outsmarted ourselves with all this.
Mhm.
Yeah.
I think you like the 143Hs, and if there's something around to rebuild in that regard, would be the most likely. They are hard to find.
The
Older
140
machines that are all-wheel drive and less.
The 143s are all-wheel drive, a little bit different than the new ones. They don't kick on as soon. They go up a wheel speed
Mhm.
to kick on, but they're antler rack and mechanical. There's a lot less wiring to them.
Mhm.
I don't know what that was.
I don't know what that was either.
Is that you?
Yeah.
Yeah, we're demoing some push-to-talk phones to replace our two-way radios.
Oh,
Oh,
show us how it works.
This is a big conversation, but the tracking that we use is hidden in the two-way radios, and we've been having a lot of trouble with the two-way radios. And it makes the two-way radios cost a lot more, and the tracking software is defunct. So we got,
So this is a phone with GPS in it or
Right.
something?
right, it's just a smartphone with a hot button on it. So it's got this button here, the thread that it keys like a two-way mic.
mhm.
And you can use a Bluetooth headset or a mic or Bluetooth push button or whatever, and it makes the app.
So it's just like a handheld FM radio in a sense then? Does it use the cell phone towers then, or does it use an actual radio signal?
They use the cell phone.
Cell phone towers,
So I think we're transitioning to a cellular-based system away from the two-way radios.
well, that would be cheap. Some two-way radios can be pretty expensive.
We've been paying about $1,250 for each radio, and 2 or 3 a year are going bad.
Yeah.
So we feel like we're paying too much money not to have a good plan, and so we're
How much are these then?
Phones are free.
Okay, it is through the,
$40 data plan, or
Yeah,
something like that,
yeah.
maybe a little bit less than that. So it's a monthly fee, so that's kind of the trade-off.
How about coverage throughout the county then?
Pretty good. We have, Ethan's had T-Mobile this is what they are, T-Mobile. Ethan's had their service on his personal phone for a long time and hasn't really found any dead spots. This is their preferred network also, so it uses some other additional signals to try and keep your signal live.
is T-Mobile the one US Cellular merged with?
Yeah.
Yeah.
We've been also resisting putting technology in the hands of our guys just because of maybe logistics. And we feel like this is the time to bridge that gap and try and get that using time tracking software and some of our inventory type things and tracking work orders digitally rather than handling a bunch of paper that somebody needs to manually input. Hoping we can solve some of those efficiencies with the phones. They only show so much on the small screens, so we're also looking at some external screens. That'll be in the vehicles as well. Some of the Service Bureau's apps aren't mobile optimized, so you really need a bigger screen in order for the layout to be usable. too that don't use a two-way radio in addition to the phones, which will follow the people but won't follow the assets. Got some options on the table that way too. Ethan's been looking into the John Deere's modem system that tracks for free but has a hardware cost. And I just got some numbers on GeoTab, which is a device you plug in that has an upfront cost but also a data plan. And all these data plans are going to add up, so we got to be real cautious about signing up for a bunch of services that have $40 a month per unit per month.
How long does the average radio last? I mean, I've got
Well,
one of my
the ones
semi
that-
that's been in there for 30 years. But
Right, the ones we're using were bought before I was around. Do you know what year they were bought?
2010, I believe.
2010, so 15-year radio. They,
so then you got to take 15 years worth of data plan and see which way.
yeah, you know, the radios without the GPS tracker in them are cheaper. But I think we were having enough trouble with the radio signals that we thought we're not leaving anything so reliable. So we just need to try something else. They're just finicky, so some days you just can't get the thing to key through and you can't hear each other. You can hear half your crew and not the other, and you'll miss messages. It's really frustrating. So I felt like if we're going to stick with radios, we got to go to the best radio system, which some of the counties are on the, what is it, emergency management network.
Same as with the sheriff's department, fire departments around, but those radios are.
700
6,
megahertz.
Yeah, but they're $6,000-7,000.
Yeah, they're not cheap.
Yeah, it's all like,
$400,000 investment.
Mm-hmm. Makes those look a lot cheaper in a hurry, don't it?
Yeah, the other part is like on our two-way radios right now that we have is we also have a repeater on our uptown shop in Thompson that's been hit by lightning before. That's $11,000 to replace every time. Just kind of getting rid of the potential cost that we own our equipment. It's just we don't own them. Phone breaks, just get another one.
And you can make phone calls and everything with it as far as,
Yeah, it's just a normal phone with a push-to-talk system.
I noticed DOT, has gone to, I think every district has one truck now that does auto steer.
Oh, the John Deere Path.
Yeah, I noticed it was a John Deere head on there.
Yeah, I've talked to John Deere on that system also. And I've also talked to LD Ag up in Heartland, that Raven system. And Raven would be a little bit cheaper. You would use the DOT's RTK instead of John Deere's RTK, which is through a third party that John Deere basically owns.
it's GPS network.
I've looked into it, it's expensive. I think, I talked to Dressler a little bit about it yesterday. I think it'd be something that emergency management and the roads would have to figure out, because it'd be used more as an emergency service than it would be just us plowing.
mm-hmm.
It's like $10,000 to $12,000 a machine to outfit them, plus Raven system. Raven system's like $540 a year for RTK, and John Deere is $1,200 a year per machine for RTKs. It's definitely something we've been looking into. It's just how to pay for it. If it's with grants, they get the equipment, and
Is it worth having for all or some machines and pay that subscription fee again?
there's something you hope you don't have to use. This year's showing that we've had 4 or 5 pretty good whiteout conditions.
Yeah. I don't think that's going to get any better. I asked last year the guy that goes through Thompson, I said, so how's your auto tracking working? He says, it's like this.
Yeah. And when the sheriff's department calls us, we can't see any better than anybody else. It's just
Yeah.
that we have a bigger machine that can find the ditch just as fast.
The view, like I'd rather drive my semi in that weather than a car, cause you're up enough from the real thick blowing stuff. Your view down is,
Sometimes a little bit better.
I think it's better. And sometimes it's bad enough you can't see in that either, but,
It's probably just because you feel safer. You're braver.
no, not necessarily. Is it just, if you make a mistake, it's a lot more expensive to get it out of the ditch.
Anything else then?
We'll have more on that at some point, but
Alright, well, it's,
kind of in trial stage at this point. Phones are free, so you don't have a lot out and trying it.
you don't have a lot of upfront investment.
No, so. We'll let you know more on that when we get into it.
Alright.
Otherwise, that's all I got.
Okay, well. A little bit early for Melissa.
I'll take a 3-minute break.
All right. Now you guys will get,
How are you?
these guys can see what I've had to put up with for years now. Once you get her started, look out.
I feel really sorry for your counterparts, not you.
Thank you. Appreciate that.
I'm glad somebody noticed.
Yeah.
I didn't think I'd ever meet anybody who could out-talk me.
Yeah. I'm here all day, so.
I've heard your name many times, but yeah.
Do you hear a sucking sound right now?
Yeah, I'm
You hear a sucking sound over the radio?
here and I'm working. Julie said I can have the extra office all day, so I'm working in public health today.
Does she have something quick?
Is it open forum?
We'll make it open forum for you for the next couple minutes.
Okay, perfect. What's your schedule look like for the 10th of February for holding the conference board meeting at 11 o'clock?
I think it'll work. I don't know
I
of anything
can't
that's gonna
think of
drag
anything
out.
that's-
Okay,
No problem.
we'll plan on that then, and we have time now to notify the others, so perfect, thank you.
All right, thanks. She didn't even use all her allotted time.
No.
We have a person that's trying to join online. Would they be able to? If they
Do
call
you
in?
have the right number?
There's a
Yep.
call-in
Okay,
number.
the call-in, okay, so they should be good.
Otherwise I'll forget. February 10th, 11 o'clock.
It can be open forum for 2 minutes.
So I'd let you guys know that if we had any studies going on in the area on your back road, if there's something, starting this morning and go for a couple of weeks, light trucks, it should say Olson, O-L-S-S-O-N, which is bird watching, hawks, any type of eagle, measuring their nest. I didn't know it, but eagles don't always go back to the same nest. Some eagles have 3 or 4 nests, I guess. They probably take whatever they are eating to get to the nearest nest. Anyways, so they shouldn't be doing anything other than bird watching. But I'll drop by the sheriff on the way out of town and let them know as well.
What's Snyder doing along the highway on their,
I wondered that too.
They got-
Snyder and Associates Engineering Company, or?
white trucks and they got Rangers and
Trailers and rangers. Actually, they're pulled into Amberson Park right now.
they've been parking there the
They've been
last couple
parking there.
days and then they go out, go out on a Ranger.
I will just be around for 3 or 4 months. They're just surveying, making sure that the surveys that are online are
Oh,
exact measurements.
Oh.
fact finding, okay.
Engineer, they know that they verify that center of the road or the center, whatever it is, on point, so when it's a lot of it's for setbacks.
that all shareable information? So we know that it's verified?
You know what, I'd have to ask. I think it's
Be nice
more
to-
just, I think a lot of it has to do with setbacks, so if something's supposed to be
Yeah.
1,000 foot, that we know that we're not at 980, you know, because I mean, if we trust, I guess the deal is engineering wise, if they trust what was, say, done 40 years ago, and then you're short, then you're in trouble.
Yeah.
Right? And then there's liability. So
And what's that company?
that's Snyder.
That's Snyder.
They're a national company that does that all.
Yeah.
All right, well, then 9:32 a.m. We'll go to Melissa Lahr, District Leader for District 2 to discuss the state's Behavioral Health Administrative Services Organization.
This. These are helpful, because these ones have a map on it. I'm gonna give you that one.
So now that they're called districts instead of regions, does that make all the difference?
Everything.
Yeah, okay, I thought that would.
Well, thank you so much for having me. I'm Melissa Lear. I'm the District 2 leader with Iowa Primary Care Association. And
I'm Marla Christoffel, and I'm the lead navigator for District 2. Yes, listening in is Marissa Grunberg. She is one of the navigators for District 2, and she is covering this county for outreach. So trying to learn about resources. And so she's listening in to kind of learn more about the county, and she'll be attending coalitions and any of those types of meetings to gather resources and information.
so the reason we are here today is just to kind of talk to you about the changes with the behavioral health system. So kind of to backset just a little bit here, and I have to look at my end time because I can take it all. I've worked with Bill for several years. Bill was on the Care Connections board with the Mental Health Disability Service Region. That changed in actually July 1st of 2025. The new behavioral health system took effect. So all the regions, there was about 11 across the state, those were dissolved. I believe Care Connections is officially dissolved. Do you know? I think so.
I think we did.
I think that went through in December. And so the region dissolved, and then we had the state issued a procurement request for proposals for two different things last year. For the Administrative Service Organization, and that oversees the behavioral health system, so mental health, substance abuse. And then they also put out a bid for the disability access points. And so that oversees the individuals with long-term care needs, so whether that's physical disabilities, brain injuries, and it can also be mental health issues that will go the length of their life. So if they need long-term care and supports, whether that's live in a rehabilitation home, things like that. So the way I like to kind of look at it, and we'll talk about navigation, Marley will talk about that. So our touch with individuals is through navigation is a lot more brief. And then when someone needs long-term care and supports, that's when they're going to go over to the disability access points or go into a managed care company for those services. So those are the two distinctions that happened. And again, regions handled all that prior. They received property tax dollars, and then it went to a state appropriation, and then over the course of time, it went to just a state appropriation, and then essentially the state kind of bought out the system, and legislature changed all of the way that moves forward. So I actually closed, I was the CEO at Care Connections, and so I closed my computer on June 30th at our last board meeting, handed it in, and then I drove to Des Moines and started my job on July 1st with Iowa Primary Care Association. So it's been a pretty, I will say for me, it's been in Marley. Marley was also on with the region as well and was one of our navigators. So we were really glad to see that transition take effect, that we were able to make that transition over. And so with those changes, the big things that I would say is so our region prior was about 6 counties. You'll see on that map, District 2 is 14 counties. And so it really does encompass kind of northwest, north central Iowa. Our biggest metropolis area is Fort Dodge in our area, and out of all the districts across the state of Iowa, District 2 is the most rural and the smallest. Big shock, right? Just to kind of give you an idea, District 2 has about 180,000 individuals in there. District 7, if you look at that, that's got your Iowa City and some of those big towns, has 1.8 million individuals in there. So, we're looking at the population, and those were done by the state of Iowa. They put the map out, and so, and then we're also conducting district assessments right now. And so I'm actually in town most of the day. I'll be meeting with Julie and her group at 1 o'clock today. And what Iowa Primary Care is they're meeting with all contracted providers throughout the state of Iowa to have a conversation about services, the good, like I always like to say, the good, the bad, and the ugly. And so in partnership with HHS, each district will have its own district assessment done and a district plan. And so that will tie into the resources and identify what the needs are in the community and how to identify the gaps, and then how we can backfill that as we move forward. So those conversations through the district assessments are happening now. District 2 was the first one across the state of Iowa. Bill knows me, I will guinea pig anything we can do. So if we can be first in something, I love to be first. And so, so our district was the first ones to get those kicked off across the state of Iowa. And so we've been hearing really good things. I would say nothing extraordinarily like earth shattering. We know kind of the barriers, they've been the same, transportation, some of those things, funding are the big things that we're hearing. But how we can, again, put the resources back to the needs is what the next step is as we continue to move forward with that. So district assessments are happening as we move forward, and that's a big portion of what my job is. I'm more, what I would say is the provider administrative service facing when it comes to programs and services. When Marley talks, she's more the client-centered, client-focused, and so we'll distinguish between those coming up. Some of the other things that I would add that maybe you might be familiar with that the region had implemented prior that has remained in stable state is the jails have access to telehealth provider. And so that's either through our communities, it's either integrated telehealth partners or Flow State. And I understand that you guys are using Flow State, I believe, through the jail. And then the hospital system that you guys utilize are using ITP. So if someone goes into a hospital after hours, they can see a psychiatrist through telehealth on that. They can get medications prescribed through that as well. And if they were deemed to need to go into an inpatient, then that case management system will make those attempts to call and get that individual placed into an inpatient. That takes a lot of that legwork off of hospitals and ER, so that's a time saver for our hospitals. And so Iowa PCA pays for that service that creates access in our services. The other thing that Iowa Primary Care does that's again remained the same is they're paying for commitments. So just like in the past when the counties would send any of the mental health commitments to the region, that has stayed the same. Behavioral health encompasses more than just mental health. It is also substance abuse. So just to clarify, if someone is just solely substance abuse and they're just committed on a substance abuse order, that is still paid for by the county. It's a little confusing because we're like, well, doesn't it get paid for by both? It doesn't, and the reason why is the legislature, the way that the code is written, in 225 and 229, it identifies a different payer. I think that will eventually get cleaned up within our legislature, but for right now, it still has that distinguishment. The one thing I would say is that if someone has a co-occurring, their co-occurring mental health and substance abuse, then the Primary Care Association will pay for something that's co-occurring. Most cases are pretty much co-occurring. When it comes to that, it's very rare that you see someone that maybe just is identified that has a substance abuse issue and not a mental health issue. But just want to make that distinguishment. Carla, and I don't know if you've sent any of your bills or anything that had any issues with payments, anything like that through mental health reimbursement or commitment expenses, and maybe your clerk does that on the civil side, but.
Not that I know of.
Good, so no news is good news, right?
Yeah.
So, yeah. So that's happening, so the commitments, and then Winnebago County also employs Ruth Melby, so the reimbursement through mental health, that also goes through Iowa Primary Care Association that can be reimbursed. And then the other thing that Iowa Primary Care has done, and that stayed, and we implemented that, I'd say also in the region, And it really went well in this area, but Classroom Clinic is a telehealth provider that is in a lot of our schools across the state of Iowa. And I know some of our schools in this area signed on with them to make sure that they have therapy and psychiatric services available so that a student can access those services while they're in school. Parents can join remotely as well, so parents don't have to take time to pick up their student from school, maybe drive to Mason City to an appointment and come back and miss the whole day of school. So that, again, provides access to our community members and our families. And so that's just a couple of the things that, again, the big thing I think last year is like, don't break it. And so that's what they're really trying to do is move the system across. Don't break it, make sure everyone is being paid. That was successful. And so now, as we're seeing things move out, there's a lot of strategic implementation that is happening across the state. And so I sit in a lot of different meetings and things like that to figure out what those next steps are, the access network, and what different things are going to look like for our communities. So that's high level. I think the last thing I wanted to just make sure that I added into that is that each district has a district advisory council as well. So as Bill was on our governance board for the regions, each district has an advisory council. And so that's a 10-member board. And so we have members from all over the district. In our region, it's hard to get rid of some of those things. In our district, the 10 that we have, it really has a heavy law enforcement presence. We have the sheriff from Palo Alto County, Clay County, Webster County. We have the chief of police from Algona. So big law enforcement, and that's pretty strategic because a lot of things that they're working on is the crisis network. And we know that a lot of people are crossing into, from mental health into our jail services. And so really looking at what that does. We also have the CEO from Prairie Ridge, so to be able to look at, representation from adult services, children's services. We have educational reps. We have individuals with lived experience that sit on that board as well, and some other hospital reps. So it's a pretty eclectic board. They have made themselves, we're getting to know each other. The last meeting we had was in person. People are asking good questions and really wanting to kind of dive in and get more information. Those are also recorded, so you can go back and watch them, and then they're also presented live on Zoom as well. So if any of you wanted to join in as well, you can sit in and watch those. There's also a public comment section where people can go in and communicate and comment as well as you can always talk to your local district advisory council members and put in a good word to them, and they can share that as well. And then as well, I'm always available for questions, comments, concerns. So
I have a question.
yes.
So Sarah Broder is in District 3.
Mm-hmm.
Why is the CEO from Prairie Ridge on our board?
Good question, because they cover multiple territories, because Prairie Ridge's footprint and what they do, they're outside of just Cerro Gordo, so because they have representation for different counties, whether they also are the Certified Community Behavioral Health Clinic, so CCBHC as you call it, and for substance abuse, they have received provider network funds, and so that crosses over through the multiple counties, and so that is why she's in multiple districts.
Okay.
If Prairie Ridge does have an office here in Morrison.
Okay. Yeah, great question. Other questions or?
Melissa, I sat in on the closed presentation out of the jail, Steve Wilquist, our jail administrator. Very positive feedback from them. They have counselors that'll come in. Someone is in jail for a longer period of time. They can do their chemical dependency evaluation. They are paying for medication as well as medication management while someone is in jail. And then they do have a service coordinator who will follow that person for at least the first month, getting them connected to services after they leave jail. So it's much more comprehensive and really focusing on the needs of that individual.
Marley's going to talk about navigation here in just a minute, and so that will tie in, but a great point to bring that up. With, prior in the region state, we had our navigator, or our service coordinators, so Marley was one. We had Anna as well, and so, I would say we were generalists, right? We covered, several counties and tried to do all things well in all of the counties. And just, that was workforce, that was, funding, that was just a multitude of things, population, things like that. The one thing I will say, regardless, everyone has their own thoughts, going from county to state, it comes with its share of changes by all means. That being said, it does allow, to put some of those more, to have a holistic view on how that can work. And so, it makes sense in the jail space to be able to have a jail coordinator that can work with multiple jails. And if you do that statewide, like Flow State can do, they can create a program and they can really get strategic, and they can also be very, very specialized in what they're doing. And so I'm glad to hear that 30 days is intentional, because most people, when they go into jail, if they're in jail for more than 30 days, they lose their insurance, right? Whether I'm employed, I lose my insurance, or if I'm on state insurance, Medicaid, I lose my Medicaid insurance. Well, guess what? Normally is expected to me. I'm normally expected to do therapy or counseling, right? I've been court-ordered services. That becomes very, very difficult when I come out and I don't have a job or I don't have insurance. So how do I follow that? Kind of set up to fail already. We don't want people to fail. So we are allowing that coordination, and then those jail services and the medications as well, so that people can, maintain their medication and have that, so that they can maintain their insurance and get back on without a lapse of services. And for some people, they may have never received services before, and so now that they are there, it's a good momentum to keep them good and keep them healthy as they leave.
Well, it also saves county money, because they're able to do that right there and not have to go to a provider where the sheriff has to transport them.
Yep, it's good for, transportation, all of those things. And really, the idea to make the inmate, we want them to be healthy there, but it helps our jailers, like you said, it helps our jailers as well. It helps just a multitude of things, helps our hospitals, law enforcement, people don't reoffend as easy. So, and then I think this is a really good time. Let's tie in navigation, because that's the other thing. The most early intervention is service navigation. And so we want to catch people earlier, before they get to jail or before they get to the hospital. And so how do we do that? It's that early intervention. So Marley's going to talk to you about this launch July 1st. It's the service navigation across the state of Iowa. And it's open for anyone to utilize, to give out the number for a person to call themselves, or for you to call on someone's behalf.
So with system navigation, the need came about because we have a very complex system, and especially if you're looking at rural counties, where do you go to get services? And a lot of times people don't even know about the services that are out there and available to them. We often get callers who say, I just want to give up, I'm tired of calling and being told no, or there are no openings. So there's a lot of people not accessing services because of that frustration. The other thing to consider is a lot of these people have maybe severe mental health diagnosis, significant substance use problem, they're under stress, and so trying to navigate the system was very frustrating for them and overwhelming. And so it was either too difficult to start, or they would get lost in the process and give up. And then, of course, you have the stigma associated with mental health, substance use, preventing people from reaching out and getting the help that they need. So state come up with system navigation, and it's really to help walk alongside those individuals throughout that process to get connected to those supports. System navigators can then be the system experts. The families don't have to know all the services out there available to them. They can call into system navigation. We take on that responsibility of really knowing the services, what's out there, what a family could benefit from, and help get them connected to that. As Melissa mentioned, we're a very brief, focused intervention, so we're not long-term.
Exit conference, but leave it running. Press 1 to confirm or star to cancel.
We are trying to get them connected to those long-term supports. Some of the frustrations are they hop from provider to provider, and that's hard. So we want to find a way for them to really connect to that one person who can walk alongside of them long-term, whether it's a case management through their MCO, or it's that CCB HC that Melissa mentioned. The other unique thing is there's no cost, no barrier. So before, a lot of times things were tied to, were you a resident? Were you on state? funding, you had to be below a certain income level. Anyone can call in. You can have Blue Cross Blue Shield and not know what providers are in your network, and we can help walk you through that. So it is available to everyone. And it's really, like we talked about, available to those broad counties. So what does System Navigation do? We provide information and education. Another thing we can do is help fill out applications. I think the Medicaid applications are difficult, and I have a master's, and I'm not going through a crisis. You try and get some of these people who are struggling to be able to fill out an application, it's just overwhelming for them. And so we can help fill out Medicaid applications, food SNAP applications, PMIC, which is psychiatric institution for children, hospitalization type thing. We help those families navigate those applications so they're not having to tackle it alone. We kind of touched on it with the jails, but we can support with key transition. Are they graduating out of high school and needing those supports? Are they transitioning back to the community after being in prison? Those types of things where maybe they need more supports during those transitions. And then we provide referrals and warm handoffs. That's one of the things I like about System Navigation is we're not just going to say, here's a number to call, good luck. We want to make sure it's successful. So when we are working with an individual, we will say, do you feel comfortable calling this agency yourself, or would you like to make that call together? We know that it can be overwhelming. A lot of people have anxiety. I hate talking on the phone. A lot of people, if we just say call this number, they're not going to because it makes them too anxious. So we often make those phone calls together. I was just working with a lady yesterday. I told her to pick top 3 therapists from the list. I would make those calls, and then if someone had openings, we will call back together to get her set up for that appointment. And then we also do what we call a closed loop. So we want to make sure the referral is successful. So we're not going to say, okay, here's your appointment, you're good to go. If the individual allows us, we are going to follow up with them afterwards. So how did that appointment go? Did you have a good connection with that provider? Did any other new issues come up that maybe you need support getting connected to? So we really want to follow up, make sure it was successful. And then once the individual feels comfortable, then we'll take a step back from that. So there are really 2 ways that System Navigation can be accessed. The first one, if it is an individual or a family member calling in, this is the way we prefer them to call in. It's to go through Your Life Iowa, and the state has hired Your Life Iowa to do an initial screening for us because we want to make sure that individuals are not actively in crisis when they call, because if they're actively in crisis but they're calling over System Navigation for housing, if they're having suicidal thoughts, housing is not an immediate need. Their stability and stabilization is the first need. So they will do a brief crisis screening. If they need crisis services, that's the direction they go. Maybe they deploy mobile crisis, get them connected with crisis stabilization. If they are stable, they will get transferred over to a system navigator who will then ask kind of what presenting concerns are and get that process going. The other way that system navigation can be used is a provider can call in themselves to get resources. So we've had schools call in and say, hey, this family's struggling with paying their rents and they're struggling to have food in the house and the parents really have some substance use concerns. Could you give me some resources to give to this family? And they can gather those resources. Or they could say, Mom's giving me permission. Could you please give the family a call and follow up with them? We've even had law enforcement in some of our counties ask, hey, we get repeated calls from certain families. Can you give me some resources to give this individual? We can't guarantee that they're going to follow up, but at least we can say we handed them those resources. So the main one is if an individual and family is calling in, they call through Your Life Iowa. But if a provider, and provider is a loose term, schools, law enforcement. I did mental health therapy before in the past, and you don't have a lot of time to do that case management. And so maybe it's a private practice calling and saying, hey, I'm doing therapy with this individual, but they're really struggling with housing. Can you give us some resources for that? So it could be all levels of providers there. The other thing that system navigation is doing, and I kind of touched on it before, is outreach. So we really want to make sure we're out in the communities, we're aware of those resources out there. We're attending coalition meetings. Slam the Stigma has been a new thing that's been fun at the schools that we're attending, and that's just having a resource table at a local basketball game, and they're having a mental health awareness night. And so anything like that, if you guys are aware of, Marissa's out there. She's calling churches. We're reaching out to daycares, and soon we'll be reaching out to funeral homes because they're dealing with people who have dealt with loss. So outreach is very broad, but also if there's something that you guys are aware of, you can leave my contact information. You can reach out to Marissa or I and just make us aware of those meetings. We'd love to attend and find out more information on that. Our top 3 across the state that we're getting calls on, we get a whole wide variety of calls. First is mental health resources, second is housing, and the third is substance use treatment. So it doesn't have to be just mental health services. Any of those socioeconomic determinants of health that can impact someone's mental health. So, you know, if someone doesn't have a place to lay their head, they're of course going to be stressed, anxious, depressed. And so that does impact mental health, and that is something that we can assist with. And then I'll try and find data, but number of calls we have, we keep track each month of ingoing calls, outgoing calls, and our outgoing calls are probably 3 times as many as our ingoing calls because 1 call in is maybe 10 calls out, you know, to find a substance use provider that takes their insurance, or it could be just 1 simple call. Here's a list of food banks in your area, and then, you know, it doesn't need anything further with that. I don't know if anyone has any questions. It's a lot of information, but if anyone has questions on system navigation.
If you're the supervisor, is there a person for Winnebago County under you?
So, and that's something that's different with the regions. We
District.
are assigned counties for outreach, but when you call in, if you're calling the District 2 specific, you're going to get any of, we'll have 4 navigators, and the reason why we do that is because it gets a turnaround time that's quicker. So if someone's working 3 cases, we don't want to throw another one on them because it takes long to reapply. So they could get the next person, we call it a queue, that's in the queue that's been inactive the longest, and so they'll get assigned that. So we may go to Marissa and say, hey, we got this call from Winnebago, can you tell us about the resources in that area? We have a really robust statewide chat. Some of our navigators, past education, law enforcement, even some bank stuff, you know, like it's nurses, it's neat to see. So if we don't know the resources, we go to that statewide chat too and say, can you tell us, does anyone know any information on ways to help this individual?
Yep. One thing that I really like about that too, with the way that the call line is set up is, so again, if I call into I have a primary care, I can either push 2 for District 2, and when it pushes 2, it's going to go through, and so it's going to go based on kind of like the last call, who had the last call, so it's going to go in order, right? And so if the navigator doesn't answer within like maybe 5 seconds, it rolls to the next person, and then it'll roll to the next person. So ideally, your call should not be missed. Now, we're humans, and we're dealing with humans, so if all 4 navigators are on the phone, there's an option to roll out to the state, so you can roll back in and talk to someone else, another navigator that might be available across the state, or you can have the option to leave a message. Again, remember, it's not crisis, so leaving a message is appropriate with what we're doing. They can leave a message and then have their call returned, and work through that as well. The reason I really like that is, again, it gives the ability to have someone within the district that has that whole area, and so they're really well versed in that in the district. But again, they can also, what I like about that as well is that if, let's say I have someone that wants to move to Council Bluffs, that's District 4. I don't know anything about District 4, so Marley or I can push 4 and I can work with someone that's maybe from the Council Bluffs area. Again, they're going to work together. All of the navigators work together, and that's different because they're all in that system together, and they have resources and technology that allows them to have that connection and that communication with one another. But again, it just provides for what I would feel like better real-time service and care rather than waiting for the officer. But that being said, Marissa is assigned, so if Julie or Ruth says, you know what, I can wait, and I'm going to talk to Marissa, then they can call Marissa and talk to Marissa specifically. So it gives multiple options for individuals to access that level of care. And again, the other thing I really like is that it doesn't matter what area you live in, it doesn't matter what your residency or what this county offers, but this county doesn't offer, it is the same technically across. And so what you get is, the services that are out there. And then what I do like is that we're looking at those gaps and we're assessing. So when there is not a service to refer to, we're looking at that and we're tracking those referrals. And so, you know what, if we see, and I'm making this up, that, substance abuse in this area is really, really high, we don't have any providers, now how are we gonna aim to fix that? We know in District 2, something that has never been done, which makes me super dork out, it makes me super excited, is that we're collecting the technology and the data through public health as well to really understand what's happening behavioral health-wise in here. And so we know that in District 2, alcohol is the leading cause of death in District 2. So county, you have a responsibility with opioid dollars, what to do with those dollars. And so we hope that through our district assessments and all the things that we're doing, we can inform you as well to say, you know what, maybe the opioid dollars that you have, maybe, and I'm not saying anything like, maybe the Narcan isn't the most important thing, maybe it's education for alcohol and things like that. And so to really target what those needs are, we want to work with that and to be able to say that. The state of Iowa has hired 3 epidemiologists to just look at behavioral health and where that's working and how that's working. Again, to put those, to put the right remedies to that. I will say in the prior state to that, it was difficult, and being a leader in that way, it was difficult because in order to make a move across the state, you had to have all your counterparts be willing to make that same move. You had to be willing to have your board make that same move as well. That wasn't the same across the state. Needs were different, things were like that were different. So I think this is going to come with some opportunities. Of course, it comes with, it's the best of both worlds. It comes with some opportunities. We lose a little bit of our local flair to that, but that's part of what my responsibility is to be that local connection, to make sure that I advocate and continue to talk. So when there is issues, problems, things like that, that I'm that conduit that can continue to be that liaison between the state. Same thing with Marley, for navigation and clients, she's the conduit for that as well. And so we continue to just get out there and make strides. It's a lot of education right now as we move through. And the nice thing is that in my prior role, I had a lot of relationships already in Winnebago County. So it's been really nice to be able to kind of pick up those pieces and move forward and to see how we can continue to dive in. We have a lot more resources than we were able to before with different teams and things like that. So I'm excited to continue to jump in and do the work here. Questions, comments, concerns?
I just have a quick question about the classroom clinics. Who monitors that in the schools, and how is it?
Yeah. So each school, each superintendent, they have the ability to decide whether they want to do it or not. So they sign on with the school, and there is some aspect that comes with. And so the school either needs to have, whether it's a school nurse, a counselor, someone available within that school to be able to turn on the telehealth equipment. And so they work that up through the contracting that the school can do. Sometimes the school uses their school nurse because they'll take vitals at that time. Sometimes they don't need to take vitals at those appointments. And so it's really, it's contractually obligated through the school and classroom clinic on who's going to oversee that appointment. And then just like most telehealth appointments, the provider will see them. The nurse or the prompt person that gets it ready stays within earshot, but gives them the opportunity to, depart and have their telehealth visit. And then family members and things like that can join in as well through that portal. And it works really, really well for paperwork, for families that don't need to do all the paperwork. It's all electronic, so we can sign consents, things like that. It makes the turnaround time go very, very fast. So kids can get in for appointments within less than 10 days, rather than taking several weeks to get into an appointment. That's not to undermine our providers that are here locally already. We want them to utilize those, but sometimes kids just need to get in and be seen quickly, and there's lots of barriers, and so this provides another safety net options for schools and families. The thing that's really neat about Classroom Clinic as well is that they provide consultation to their teachers as well. So it's not just working with the student, it's working with that's faculty and staff to talk about how do we work with the student? What do you need? What are the resources that you're going to need, or some tactics to work with that as well? that's the other piece that's huge to the school. They want kids to get treatment, but they also want to know how to work with that child and how to best have that relationship be so that it's a healthy environment for both. And so that's really the piece that I think sells it to schools, is that case management piece for families as well.
Thank you.
I know throughout this process, there was several of the superintendents were pushing to have some involvement in it, and they really wanted to be at the forefront of it.
And we're seeing that. I think a lot more. We're seeing, you know, the stigma of mental health. I think COVID did a lot with, you know, destigmatizing it, you know, and we're seeing that. And we see 988, you know, plastered a lot more places, you know, as the substance abuse, behavioral health, suicide crisis line. And so it's okay to talk about, you know, and everyone has mental health issues, whether good or bad or indifferent. And so to really make that known and to get it out there, I think that's the most important piece, is that education and that early intervention. And I think if we get people calling early to get into therapy or get their children into that, then hopefully we won't have individuals getting sick on the other side. And the one thing that I didn't share about, because it's still working, is that Iowa PCA has a team of individuals. They have a child consultant, and so they're work for us, but individuals that are going to work solely with jail services, with pharmacy services, with early intervention, with recovery. So really tapping in and really doing some in-depth work on the research, evidence-based practices, the training and technical assistance. And that's the part that I'm excited, is because for our smaller communities, our smaller providers, or our big providers, that's one of the things I'm often hearing, is that training and technical assistance. Like, we don't have the money, we don't have the time to send our people to maybe Council Bluffs or Des Moines. So how can we have the experts come into the communities and teach individuals and offer that in a different way as well? And so again, when we're doing it on a statewide, it's a little bit easier to make those decisions. It's a little bit easier for operations and things like that. And so, and I think Bill knows me well enough. I'm a very strong advocate for District 2, that I really, really do my best to say, we're gonna do it here. And again, I think we're uniquely positioned because Care Connections was one of the smallest regions. We're the smallest district. I'm always like, let's go first. Let us try it. Let us do it. We're nimble. We can move. We can adjust if we need to. So let us be, you know, let us be the person that's going to try when we're moving forward in some of this. And that's always, in my past with Care Connections, that's always proven to be pretty successful with what we're doing. And so I'm excited to continue to carry that forward here.
Thanks.
Thank you very much.
Thank you.
Yeah, I'll be in town the rest of the day, so if you guys want to, I'll be over at Public Health. Julie has offered me some space for the day, so if anyone wants to come over, feel free to come on over. Otherwise, I plan to be out and about today as well.
Wonderful. Thank you.
Thank you.
I'm gonna leave it.
Want a break? Take a break?
Iowa clerks too.
Right.
Oh,
Take
great.
the
Thank you.
hand around.
Thank you.
I just feel fortunate we have our own eclectic representative on the advisory council.
Yes, yes. I noticed they didn't invite me to be on the advisory council.
Man, I don't know, now all the spots are full, but if one opens up, Bill, you'll be the first one to call. You'll be like confident in it for it.
I thought you were gonna say there's an open spot in the school.
I wouldn't put that past him either, like, you know. Yeah, I did get, I've been talking to the regional attorney a little bit, and Carmen, so it sounds like everything's dissolved, and
You know, I don't remember. I thought we were gonna have one last meeting in December I mean, we officially kind of dissolved it in August meeting.
yeah,
And then I think it was gonna be, we're gonna have one in December if we thought we needed to for some reason, but evidently we didn't need to because I never got me.
yeah, I kind of wondered, there was a subpoena that was, the attorneys from Osceola County, they were trying to subpoena, and so we were trying to go.
on my
I kept telling them, I'm like, you better charge us really, really quick, otherwise we're not gonna be able to pay you for this. And so Carmen and him were working with it, and so I think that's probably all been settled, but that was the last piece that I was kind of chatting with Jason. I'm like, you may get the bill, I don't know what's gonna happen with this, but
Mhm.
it's been quiet, so I don't know, but we'll see.
Services, are they better or just kind of the same as it ever was.
I really do like the navigation. I think that they're serving a lot more people in that because it's just more open and broad for people to get out and call. So I really do like that. You know, I think anytime you work for a statewide entity, you know, it's just different. It's not your county. That being said, I feel that Iowa Primary Care is very unique in that situation where they're not a managed care organization like we see across the Medicaid world. I really like that because they are strategic, they're very smart, but yet they're very ethical and want to really do the best for individuals. And because they've worked with community health clinics for so long, that, you know, at first I didn't really know how that would lay over in the behavioral health world. It lays over very, very well. With like the pharmacy side of things, I've learned a lot on that side as far as like medications and how to use the federally qualified health centers and things like that to incorporate some of the gaps in our community. And so I think putting those together especially in a rural health model, is going to do some good things. And I think it just makes sense. Primary care, incorporating behavioral health care and making it just normalizing it, it's going to go a long way for our communities. And to be able to go into your hospital and be able to have a therapy appointment and check into the same desk that I would go see my physician, that also works very well for people. People tend to show up and do their appointments a lot more when it's not secure, you know, when it's not somewhere else and they don't see my truck in that driveway. That's a big thing. So that's been helpful.
All right, well,
Thank you very much.
No, thanks.
thank you for
Thank you.
the cranial cogitations from your illuminating discourse.
Have all those cool things she says already. Steps.
Hi, good. So I was having lunch at Hickory Park in Ames the other day, and I noticed an Assured Partners office across the street from Hickory
Is that
Park.
a really nice one, isn't it?
I don't know. I didn't go in.
One of my coworkers went over there and he said that one's a little nicer than the ones we have.
How many offices around the state are there?
Oh, gosh. I would guess probably 12. I could probably give an update on that based on our conversation. Carla almost fired me without board approval.
Yeah.
And it was fair.
I saw on LinkedIn that Brittany had started working for Gallagher, and I was like, what's going on, Brian?
All right.
I'd have to know.
The back of this one too. Okay, 10:15 a.m. Brian Honecker to Assured Partners or Gallagher, whatever you want to discuss insurance renewal.
Yes, so good timing on that commentary. Assured Partners did get acquired, it was announced, don't quote me on the exact dates, last year by Gallagher. It had to pass Department of Justice, monopoly type scrutiny and officially, September of last year. So, nothing has really changed internally for our team. I just was teasing Clara, I got a pen. But Gallagher, Assured Partners was a large organization. Gallagher is even bigger, and they do have some robust capabilities that we're we're learning about that could help us down the road, just in terms of their size and access if we're ever to go down the self-funded path, other benchmarking tools and data. And probably the biggest thing that I've learned since the transition, we had a big meeting of Assured Partners people with some Gallagher people in Chicago 2 or 3 weeks ago. The amount of money that they are investing, and you hear it every day in every industry in AI and other tech is mind-blowing, but they think that's the wave of the future, to be able to identify things in the health world, hopefully identify claims or risks and things ahead of time. So for the time being, it truly is business as usual for us. The ISAC program, Brittany is still on, and I think I'm about to take a little bit of leave of absence for baby 3.
So Assured Partners, where were they based out of?
Lake Mary, Florida.
Lake Mary,
So
Florida?
we had about 11,000 employees with Assured Partners, and Gallagher's in the 70,000. So it's
Where's Gallagher based out of?
they are out of Chicago suburbs. So yeah, but regionally and truly, our flow isn't changed at all, except for some business cards and other things. As far as our day-to-day is the same mission and really same freedom to help our clients. There hasn't been any.
Do we have a name change then, or
Pardon?
is there going to be a name
Yeah,
change then?
Then that's actually what triggered, I think, and I am the opposite. My job probably is in jeopardy because of my limited tech. And Brittany, we had to change our LinkedIn pages by X date, and that probably popped to Carla and some of our logos and branding. I think it was the largest merger in the history of insurance, so it's going to be Gallagher and then or Assured Partners, a Gallagher company. They're still figuring that out at the corporate level. But I'll always be living in Iowa, so I don't know that it's going to affect a whole lot. But it is good to bring up, because it truly, from my day to day, what Carla said that I was caught off guard. It's almost like a old hat for what we do. I come with good news. If it would have been a bad renewal, we would have had to do a Zoom, but.
Yeah, there you go.
Or you send
Or
Brittany?
send Brittany.
Yeah, that's exactly right. But as we kind of talked about last year, we were really in a great position with that move to ISAC. The top portion, and then what, just in talking with Carla some, the top part is essentially the premium that we pay to Wellmark. Last year, yeah, go ahead, Terry.
Why does it say Fayette County on top?
Oh, because of my tech skills. That meeting was yesterday. These are your numbers.
Okay.
They're about $2 million in premium. So those are your. I apologize for that. So this top number. These are the base premiums that we pay to Wellmark for that higher deductible plan, and then we do the buy down from that. One thing that helped our renewal was on our traditional plan was about 3%. If you remember, one of our kind of consulting pieces last year to move to ISAC was the first year renewal, you get slotted into their trend increase, and ISAC has been running really well as a group. So we thought we'd be in the 3 to 5% range because they release their renewals pretty early, and we moved to them in July. Claims are always about 2-3 months in the rear, so when they give you a renewal, they really don't have anything to go off of. So year one, you get the base increase. They did add a higher deductible HSA plan, which last year it was kind of odd because we moved from a high deductible
and don't quote me exactly, but I think it was 7,500-ish with Wellmark when we were standalone. And the highest plan ISAC offered was 3,500. And we fund that down to 3,000, so we had very little risk. But we also were paying kind of a higher premium for that plan. So ISAC this year, seeing that need, they offer a higher deductible health savings account. That actually allows us to move to that higher plan, save a little fixed cost premium. We will have we'll have more claims risk, but that spread is not a concern for us. We are one of the reasons, along with a couple other counties that have recently moved, that ISAC offered the higher deductible plan because it just makes sense. So how the numbers filter out is we truly can keep our employee rates the exact same year over year, the county contribution the same, so truly no increase to budget, and forecasting additional gains to our reserve fund. So we're in a unique position. I think last year I told you you're my poster group, my favorite group, because we really do have in a world of year by year, we don't know what is going to happen next year. We really are looking out over a multi-year plan with our reserve fund being so healthy and being added to that. We're not going to have to increase very much or at all in the next few years. That kind of leads me to this bottom piece, and I know Carla on Thursday, are you meeting with Brad?
Yes.
They're coming over from Ellen McKee, and ISAC does have up to a 5% discount in our health rates. That would be 1/1 of 27. If our employees, if we reach certain thresholds on getting a physical and having your doctor turn a form in and taking a health risk assessment, we could get up to a 5% reduction in our rates 1/1 of 2027. So I know they're coming over to talk with Carla this week, and hopefully we can continue to market and emphasize and work with our department heads and leaders to, you can't force anybody to get a physical. I know some are, heck no, I'm not doing it, I don't want to know.
I can't believe they'd be that way.
Well, in that meeting yesterday, it was interesting because we had a couple that were like, yeah, that is me. But to show there are real dollars, and I think people understand. Obviously in the news, cancer rates in Iowa are going up. For younger people to catch stuff early it's a big deal, and ISAC they do have the data behind their program to show they're investing significant money into this, but they're seeing significant return on catching, a cancer at stage 1 for a 48-year-old. That thing's not going to get caught till it's stage 3 or 4 because they wouldn't likely go to the doctor at that age for certain things. So that part is exciting. We do not have our dental or vision. Vision's coming out of a rate lock. I'd be surprised if we got much of an increase at all, but it's so inexpensive that'd be pretty minimal. Dental, we've been stable the last 2 years too, and we'll know that in the next bit. But wanted to come over, as obviously everybody's budgeting and things. And I know Carla. I think you said on the phone, Carla, you put something in for the budget.
Mm-hmm.
If you wanted to grow the reserve more with a 2% budget amount or things that is an option. I really don't think we need to. But at some point, that money stays with you. It's the counties, it's the employees, so it's not. I don't mind doing that versus cutting the check to Des Moines, and that money's gone whether we have claims or not. So we're, in a sense, anything we did budget or increase, we'd be patting ourselves for the future.
So what's our magic number? Are we looking at an increase?
I mean, even if we did 1%, I don't know, but if we don't really need to at this point, I'm not.
We really don't, what you did last year in the strategy of, to me, reinvesting the savings into the side fund has set us up to be unlike virtually anybody that I work with. And there is a point, at some point that fund can get too big where it's, we're not there, but if you wanted to do a percent or, I don't think that's a bad thing, but not necessarily. I kind of like the thought, I love the thought for HR and for the employees to say, we don't have to touch the deductions. We got, if they get a raise, it's not getting offset by, so many of our groups are, here's $1 raise, but health insurance is gonna cost you $500 more for the year. So what was your rate? In real dollars, they didn't really go up or not up as much. So this is definitely a positive that way.
So with the health risk assessments that you could get savings with that, it would have to be a percentage of everyone, or it would be everyone, or?
Percentage. So on the health risk assessment is if 60% of our employees fill out a health risk assessment, we get a 1% discount. And then the physicals are 50, 60, 70, 80, I believe, percent. You get a percent. If you have 50% of your people get a physical, you get a point. If it's 60, you get 2, 73, up to 4.
But then up to 5.
Yep.
You get the
4 plus the assessment.
Okay.
To get 5. And they've got some other dollars and exercise things that the ISAC team will go over.
There's also, if you do your health, your
wellness thing.
physical, you get $100. If you,
Do like so many steps, then you get like $1 or something. I
Yeah,
can't remember how they worded it, but.
they give so much towards a Fitbit or Garmin or like some kind of a wearable device, and then I think it's $75. And then once there's a certain amount of time where if you do 10,000 steps, you get $1. If you do, I think it's 8,000 steps, you get 50 cents. So there are things that they're doing to help us become a more healthy group.
And have you worked with Molly? Have you talked to Molly Hill?
A little bit, yeah.
They have a full-time dedicated wellness person in the ISAC office that's kind of leading
Is that who spoke at that meeting that we went to? Was that her, Molly?
I can't remember. I think so.
Mm-hmm.
But Brad and I don't know, Brad and somebody else will be here on Thursday.
I think Molly.
Molly.
And Brad.
Okay. So that, it's a mandatory meeting for all employees on Thursday. Secondary roads is at 7 at the Thompson Library, and then there'll be a meeting here at 9 and a meeting here at 10.
What day is that?
Thursday.
Oh, that's statewide supervisors meeting.
I can maybe record it for you.
Okay.
That would be good, because I have a place who will be gone. She's not. I mean, she's going to be off on that.
Okay.
No way she'll be.
But in terms of next steps, if we wanna wait for the dental and vision and do it all in one, we can. ISAC can prepare the paperwork, which would be the only, we would stay on the same traditional plan, we would be moving to the higher deductible. HSA would be our recommendation based on the numbers.
You're saying a higher deductible, the buy down to the same, or?
Yeah, exactly, yep, same plan design down for the employee, buying a higher deductible from Walmart.
Nothing's gonna change on the employee end, except the little stuff.
Well, I guess that's good news.
Yeah, really good news.
I remember the days of struggling.
They were pretty scary, some of them.
Oh, yeah.
Especially the one year.
Yeah.
Got some, 12.5, and we had a 22%, and that's not in the budget, as you can imagine. That's tough decisions and.
Okay, any other questions? If not, I guess we'll,
First
move
one,
on.
first when I saw Fayette on there, I thought maybe they were joining counties already.
Oh, yeah, no, we were already merged, yeah.
Now we're over there, and
Yeah, don't-
Fayette wants your rates, don't.
Yeah,
They would be thrilled to join.
Doge is doing it for us.
Yeah, thank you.
Yeah, thank
Yeah,
you.
thank you.
Rest of the day.
Yeah, you too.
Thanks. I don't have to if you want to keep it.
All right. Move on to number 7, set public hearing for fiscal year 2025, 2026 budget amendment.
what do we have on the amendments?
I don't have it in front of me.
Was our discussions from yesterday included on that, the transfer of the leftover funds from the plant, fixed plant?
Yeah.
Okay. What, are we gonna be a little conservative on that in case there's more repairs or something that have to be done?
Yeah, let me call.
I want that guy's voice on the radio.
Oh, yeah?
He's the best. It's a booming voice. You can understand it clearly, and
Which one's he on?
that's the dispatcher.
Oh, on there. Oh,
One of the
all
newer
right.
ones. And there's one in there. I don't know if I can pick her out or not, but she.
Yeah,
Just
no,
like-
no, my wife has a pager, and there is a difference. You gotta get right next to the thing and listen to it, and it's like, what the heck is they trying to say?
are sticking together today. I may have missed some.
So did you sign your other spot then, on yours?
What was that?
You have to sign there too.
Oh, up here, approved by department?
Yeah.
Oh, we just had to sign it up there.
Kelsey's got $650 change for her educational fund, and $350 for office equipment and service agreements. The sheriff needed to add some to commissary, opioid, and food preparation services. Public health. Has 10,000. She didn't write what her line items were for, but she has 10,600, 500, 200, 3,000, 3,000, 17,000. Those are all for public health. Sanitarian, she's adding 8,800 to his budget, and general assistance, about 40,000 that budget.
I noticed the sanitarian was a little underwater a few times.
Veterans Affairs, looks like we didn't budget for workman's comp, so there's about $900 there. Secondary roads, there's some salary changes, engineering. So about 40,000 there. Looks like it's about it,
Plus the transfer.
plus the transfer.
Nothing earth shattering anyway. So what date did you want the public hearing?
February 17th, 2026 at 9:30 a.m.
I'll make a motion to set the public hearing for the fiscal year 2026, or 2025, 2026 budget amendment for February 17th at 9:30 a.m.
I'll second.
Motion Derby and a second from Smith to set the public hearing for fiscal year 25-26 budget amendment at February 17th at 9:30. All in favor say aye.
Aye.
Okay. Consider for approval county claims.
I'll make the motion to approve the county claims.
I'll second it.
Motion Smith and a second from Derby to approve the county claims. All in favor say aye.
Aye.
Consider for approval payroll claims.
I'll make the motion to approve the payroll claims.
I will second that.
Motion Smith and a second from Derby to approve the payroll claims. All in favor say aye.
Aye.
All right, discuss budgets.
Do you want to do the boards and appointments first?
Sure.
Oh, yeah.
So we added Chris Singlestead to replace Don Helgeson. He had no problem with that
Oh.
when they finally got to talk to him.
That's great.
on eminent domain.
So are we missing anything then? Is that the final one?
No, I still haven't heard from, Hazagat tonight. I didn't call him. He said he was gonna get back to me. I guess I kinda,
Call him up and then we'll have it done.
Thought for sure that little person in the back corner was gonna have a nervous breakdown.
who? Yeah. Anything that might expose.
So is this an approved or is this just a received? I think that's just a
be received.
Sorry.
Lyle Heppen, we're keeping him.
Nope.
No,
No,
He's
he's the
off.
one that Kevin would be.
Kevin,
Hasbro.
Oh, Kevin? Yeah, this is Bill Johnsvold. How are you? What did you, ever decide on that?
I think I'm gonna pass.
You gonna pass on it? All right, I'll have to find someone else then. Oh,
Sorry about that.
alrighty.
Alright.
Yep, bye.
Who's on it from Buffalo Center now? Just,
Lyle Heppen.
Well,
How
Heppen
about-
was
how
on
about-
there.
Has-
No,
how
he
about
has
the
to be a
other guy?
business owner or property owner.
Says
I mean-
bankers and business people.
He's not a business person anymore, so,
what about Hasbro? Steve?
well, I could ask Steve. Isn't he on it already? Under
Another-
something else, another group?
Probably on another board.
Yeah, he's under real estate.
Yep,
Oh,
yep,
okay.
yep.
Who else you
Um,
got over there?
Who works at the bank?
I could get somebody at the bank, I guess. I could get Jeff Osterman.
Right.
Probably be
Julie Newton.
Jessa,
Julie Newton's there.
Jessa Worth.
Yeah. Nancy Mockelstead works there. She's not from Buffalo.
Well,
She
neither
works
is
in-
Julie Newton.
Yeah, that's true. Jeff
I mean,
actually,
Julie's from Thompson, but
Jeff actually, I'll ask Jeff if he wants to. He's a young guy and he works in the. bank
Pencil
there.
him in, Carla,
who?
this Jeff, and then he can twist his arm.
What's his last name?
Osterman?
Tell him that we've
The
already,
sales point is
Pencil
we
him in.
haven't ever had to have this meeting.
No, I told him, I told Kevin, I says, I bet Lyle doesn't even know he's on it.
he didn't when I talked to him about going off.
Yeah.
When I talked to Chris Singlestead about it, he says, oh, I've been on planning and zoning, and we've only had one controversial issue in in Lake Mills, and we made it through that, he said.
Yeah.
That was the car wash one.
Yeah, that was kind of
Thought of
controversial.
it, I could have talked to him.
Nothing that buying out the neighbor didn't solve.
And building a retaining wall and.
So do you wanna do that with,
He's
or do
got,
you wanna wait again?
who, Jeff?
Yeah,
I'll talk to him.
okay, so,
You wanna
He's-
wait?
So then we're done with boards.
so I need should I do a motion to approval, or do you wanna wait until you?
Absolute. You know, I got his dad's phone number, but I don't think I have his.
Just call the bank.
Yeah.
Boy, you guys, I did all sorts of research on bonds. Did I send you a bunch of stuff?
I don't know.
Oh. Can we post so that we can all go to that next
When
conservation?
is it?
You know, I'll have to look it up. It's usually the first Monday. Actually, I tried looking it up.
Yeah, Janelle, this is
Couldn't
Bill
find it.
Jensvold. Is Jeff Osterman available?
Let me look.
Sure, thank you.
February 9th, 8 a.m.
Yeah, I'll post it.
Thank you.
And that group is, yeah, I guess you could.
February 9th, 8 a.m. Winnebago County Conservation.
Yeah, Jeff, this is Bill Jensvold. We need somebody to be on the eminent
Carla's
domain
posted.
board. Lyle Hippen is no longer a businessman or a banker in Buffalo Center, and we were trying to think of somebody who could be on that. The good news is most people don't know they're on it because it never meets. But anyway, if we ever have a pipeline come across our countryside, you could have a word in it. But give me a call back when you get this message. Thank you. Bye.
That's at 8,
9th,
9 o'clock.
8 o'clock in the morning.
Yeah.
Yep.
Carla, more than one of us is gonna be at the Farm Bureau meeting on the 12th at 7 o'clock, I think.
12th,
February 12th.
7 p.m.?
Yep.
Alright.
And then the other one was, there was another one that week, it seemed like. Can't remember what it was.
If we ride down to the statewide supervisors meeting together, do we have to post that?
Probably should,
Make sure nobody wants to ride with.
yeah.
Thursday, that's the, what, 29th?
Yeah, I think so.
Probably.
Yep. What was that other one I was thinking?
Is it in February?
So what I was trying to tell you earlier was, I was still getting budgets from people last night. So
How's Andy doing?
that's the one of them. So, I got that, and then, so things are in here, but it's not done and it's not all together yet. I still have to put in the debt, I still have to put in getting balances.
So, how do you communicate? Do you just send them an email and say, I'm still waiting for this?
Mhm.
I suppose Andy had to go through Hancock County. They had to set their part of it. And
Yeah. But if you look at this, page 13. Except for the little basic, cause I gotta put in Scott's transfer, which is 1.6 million. So that gives you an idea what we're gonna need to levy. Dollar amount wise.
Why is the fund balance, total ending fund balance a negative number?
Cause I haven't put in the beginning balances yet,
Okay, all right, that's it.
but that also gives you an idea how much, I mean, that's really what we need to levy for those things.
What was the total requirements last year, do you remember?
No, but I can print it out for you.
So if the governor gets her way, then we're gonna be limited to 2% next year then.
Mm-hmm. That's where it sounds. Well, plus new growth.
Are you discussing budget? Or
Yes, we are.
We're looking at the sheets.
do you have time to read it with me?
Sure.
Or do you want me to?
No, that's fine.
Okay.
last week when I was in, we talked about the postage machine.
Hmm.
So I think what we're gonna do is we'll keep trying down in the auditor's office using that machine at this time. So if we want, we can go through some of my line items. I will lower both postages in here. I still need postage coming out because of our mailings that we do for the municipalities. But I do need to increase some of the other places. Because what we do really need would be a check receiver in our office. We're still using a very old one, and we've been inking it, and it's getting to the point where it's not working. And I talked to Carla about getting it through Tyler and running it through the printer system, but the ink is so expensive, and we don't justify enough checks like they do in the auditor's office. So we've been always using an old machine that we punch in the numbers what our check is gonna be and we receive it. And I just need to replace that. So if you have time, do you wanna go through a couple of my line items?
Yep.
Or do you want me
Sure.
to- The gals have been coming down, and I have been down here a few times, running the mail through the auditor's office. And it does take some time, but we have to bring the mail down here anyway. So the gals are just,
Good.
we have a box going out for today and a box that we're earning for tomorrow. So we're just gonna try it.
So you'll only do it once a day at the most anyway,
We're gonna
not
try it.
coming down.
Yeah, we're gonna try it that way and
Okay.
just see, you know, how it works for
Seven.
everybody. We will have a big mailing out this week for the delinquent letters. So that's gonna be several letters going out. So we'll just see what it takes, time for that.
Where do you wanna start?
Well, let's just go right on page, I think you guys are on page 7.
Yep.
Mhm.
So general office supplies, under the motor vehicle number is the third one down.
What's that gonna be then?
This motor vehicle, ends in 26,000.
Yeah,
Mhm.
Yep, and I had 2,000 down, but I would change that to 1,000,
okay.
or, I mean, not 1,000, 3,000, increase it 1,000.
Which one's that?
Third one
General
down.
office supplies,
Okay.
increase that 1,000, so it'd be $3,000.
So that's twice what last year is?
No, well, let's see. Last year, right, because I run into trouble when I'm trying to purchase envelopes and, motor vehicle title work envelopes. So I just thought, instead of worrying about a budget amendment, if I don't need it, I don't spend it. At least it's there. So I'm just gonna increase that 1,000. Cause I think I had 1,300 before.
Yep.
Mhm.
And then printing and notices, because of the postage continuously going up. And the printing, we're switching companies for the, renewal notices, so I'm not sure how those are gonna run us. But I would increase that 1,000 to 3,000. Then the line for motor vehicle postage, instead of what I had asked for 9,500, I'll drop it down to 6,000. And that should hopefully cover the postage on the renewal notices, because that's the only thing bigger that I should be paying out of. And then, should we just go line by line? Make
Sure.
sure we have it.
The motor vehicle one, what did it say?
The motor vehicle postage,
Yeah,
I had 9,500.
why am I not seeing it? Is it that
there.
tough?
It's under postage.
Oh, it just says post, yeah, I'm looking
Yeah.
for motor vehicle on the front of it.
Yeah,
All right,
the
all
top
right.
part is motor vehicle.
All right, and that one's going down to what?
6.
6,000. And the next line item for mileage and substance was 200. And then I had 400 for the phone. 200 for educational and training. Most of this we are able to try to do online. And then we have office equipment and repairs, 300. Nothing under the next one, equipment, office equipment service. Office equipment and furniture is 500. You guys have that one?
Mm-hmm.
Okay, and it's 0 again, and then we jump into driver's license salaries, nothing there changes, but if you go down to, the 90/20, which is the tax side, general office supplies, I had 2,000 there, gonna up that 1,000 to 3,000. And then in that tax side postage, I had asked for 8,000, I'll drop it down to 3. Just to be safe, and then maybe next year we can do away with it completely. But I hate to not have anything there. That's and everything is the same on the next page except for the office equipment. I had 200, I'm gonna bump that up to 1,000. Cause I'm not sure how much this receipt machine is gonna cost.
What are you changing it to?
1,000. I had 200, but you know, I'm not sure how much the machine costs. We've been searching for it for a while. We just can't find anything that is.
But you think 1,000 is enough?
Well, I would use that plus the motor vehicle 500
Okay.
for office equipment. Hopefully it won't cost that much, but at least I'm not.
I wouldn't have a clue what that would cost.
No, and we've done a couple different ones, and they just are not as good as deals. So we're just gonna keep asking around and see if a bank has ideas of where we can get something like what we already have.
Oh.
So does that help with the budget?
I think so.
Yeah,
So I just
couple
don't-
big changes.
Yeah,
So,
if that works for you guys, and Carla will keep coming down the rest of this year, or see how it is, and we still have postage in our office that we're gonna use for our odd pieces that we are mailing out, to get that cleaned up. And then see how it goes, and if we decide that it is worth having a second machine, we can go ahead with that, in another year.
good.
Because I did talk to Elizabeth too, and, we had some a good conversation back and forth on purchasing another machine. So she said it was basically up to the board. But I think if this is gonna work out, we'll do it that way, and then purchase a better check receiver.
Mm-hmm.
You guys have any questions or ideas for me?
No.
I can think of.
Thank you.
I'm sorry to interrupt, but I just thought if you
No.
were going over
No,
budget.
We're budgeting.
That was budgets, and we're talking about budgets, so.
Yeah, I
Yep.
figured I could cut some costs there and
Yeah,
cut a little bit more back into where
Mhm.
that works.
I'm comfortable. All right,
All right, thank you.
Moving over.
did you need anything more from me, Carla, then, or you got it changed?
I don't, yeah, I'm good.
All right, thank
Thanks.
you.
All right, what were we talking about?
I don't know, I was just looking at the different pages of, like, page 4 of 15, the, max dollars and so under general basic, our taxable growth was 9.42, and on the rural basic it was almost 12. But we're limited on the revenue growth. Are we gonna be able to stay within those numbers, you think?
Hold, I'm looking at, so we're gonna need to add about 15,000 to 54 for postage.
Oh, for everybody.
Yeah. On page 56, I'm not from the bottom of that page.
So that'll be 15,000?
Mm-hmm,
The second one up from the bottom, you said?
mm-hmm.
So we didn't have anything in it before.
Yeah.
Do we have that in our budget amendment? Do we
Nope.
need it in there?
I need to put that in the budget limit too.
We had nothing in it, but we had, 20 by
Expenses.
26, we've had
And
some.
we're not done yet.
That's why I waited an extra. I actually don't like to do a budget amendment to go with our budget, but
We still have to put in the congregate meals.
yeah, I did that too. I got that in, I had the congregate meals and the RSVP switched around, so I fixed that and put 8,000
Oh, I see.
and then the 97.
So they just gotta slide down.
Yeah,
What about, oh, wait a minute. So HHA RSVP is 8,000 then?
yeah,
Okay.
yeah, I just have those two reversed.
But you still have 8,000 in home base Iowa then?
Yep.
Okay.
What'd you say about congregate meals?
9776?
Yep.
Which ones were reversed?
Well, not this, well, this is what it should be. That one
8,000
should be
there.
8 and 9776.
Oh, mine's got the 9776.
Do you think our printing and notices are gonna be less this year? Down to one paper?
Should be.
You increased it, but so far, we're not doing too bad.
Yeah,
We're gonna just go back to 4 then on that?
yeah, we can do that.
Maybe next year we can drop it another.
Yeah, I went down on board proceedings from last year, but with that new, columns, the way they do that, it just increases the price. So it might be one paper, but it's expensive. They make us put our legals into a certain system, and that system pays it, or charges us for our legals, and then we pay the paper separate for different things. So it's just,
So the printing and notices do what?
so printing and notices are, like, if there's a manure management, a new thing, and I have to do notices to people. It's also notices for, like, budget amendments, budgets, that kind of thing. And then board proceedings is just the minutes.
Okay. Oh, we'll have to watch the board proceedings, see if we can get by with less next year.
Mm-hmm. And I'm thinking we will, but I just,
Well, the indication now is that it's gonna be less.
yeah. If I print this one, 126.
Is there gonna be labor relations this year?
There always is stuff with that, just because we always have.
Trying to think what their contracts are. We got
3
one more
years.
year, so
Is
we,
there another year left on that?
Well, we open it for salaries,
yeah,
but it's also random HR stuff, and Kelsey uses it a lot, and
oh,
so it's not just,
Kelsey uses it for what?
some HR stuff. She uses it,
Union stuff?
not union,
No?
I deal with unions.
Oh.
I don't know, random HR stuff.
Yeah, it's like, no, I can't spit out his name, I just had it. The attorney we use for HR,
Mike Calloway.
Galloway, he comes out of that.
So the account auditing clerical service,
Mhm.
that's Elizabeth.
Yep. It's also, Cassie.
Hmm.
Cost advisory services.
Okay.
I might have to add more than 15,000 to that because I didn't add secondary roads
To the
postage.
postage?
Yeah,
What do they send out for?
random stuff.
They usually don't have mass mailings.
No, but I'll ask Scott how much they have for postage and I'll need to put that in there.
So. Plus.
Let me just ask him what he budgets.
Must be grouped under something else.
Not seeing anything for postage anyway.
That's why I need to ask him.
Well, Well, I don't know what their general supplies is for 45,000. Pretty generic term.
That's a lot of general supplies. What's it say?
And they're using it.
Grease and oil or whatever.
It's like they went over budget on it last year.
Help me out. Where are the monies that we spent on a fire?
That was, we
No,
just
just
saw
on the
that.
page we were on, 54.
54.
The 200.
Fire, rural fire services.
271 or whatever it was, or 241,
Page
something.
56.
So looking at Scott's budget on page 31, you know, general supplies, he was over last year. His land improvements, that was probably to do with his project. That was over. And then he had salaries of 15,000 that went to almost 57,000. Was that to do with the project then?
I don't know, you'd have to ask him.
And we're already over budget this year on that salaries. I don't know what.
Well,
Is that changed though? Did Carla change the salaries on secondary roads?
I usually don't touch his,
Okay. We could have him back up here.
he's only
He's
got,
probably down there.
only got 20 proposed for, so it must be to do with the work crew out there doing their own dirt work.
Yeah, but he should have had that in his other salaries as a day-to-day operation.
Yeah. Well, let's see, did
let's just call him, it's easy
Yeah.
to
did the other
call him
salaries,
Call him up.
speculate stuff.
Oh, you got it.
Can you come up here? Thanks.
none of the salaries on page 30. See, 100,000, there's only 12,000 in there so far this year, so that's gone down considerable there. He's asking for 100,000 for it next year.
That might be a seasonal thing for summer,
Yeah.
bridge projects, stuff like that.
Yeah, with
So, if you look on page 10 of your budget, it says what categories all those things are. So like if you look at category 7,000, it's administration, 710 is engineering. 7,100 is so all the way down, so you can
7230. Real estate and buildings.
well, it must be what that is then.
So that's another problem. So like 7,900 he's got there, he's got money in. That'll cause me problems when I go to do my annual report, cause there's no place to put that.
The 6629.
Well, all of them, the last 1, 2, 3, 4.
So the 7,900 category is not on our sheet.
Yeah, so it's gonna cause me problems.
That's something he just added this?
I don't know why, where, who, how, but
So we're sorting through some of your line items, towards the end of your budget. We were looking at 7230, and we figured out that was for your properties, salaries to improve properties, or how was that working?
7230, the 820 salary line.
Yeah,
Yeah, labor for buildings and grounds.
what did that actually pay for then?
The dirt work and stuff out there at the new
Well,
shop?
that's
or-
that line item that would have been used last year more heavily for all the site work we did. So all the guys' labor, the dirt work and
So if they're getting paid weekly or bi-weekly, so then it's lowered something else then? If you're putting that burden on that one, did it come in lower on something else then?
Well, one of the ones up here was lower.
every year I total up our salary numbers
Yeah,
and then try to adjust it by what the raise is gonna be or what our projection from last year and what total wages are and try to project out from there. So some of those labor categories go way up or down from year to year depending on what we think we're gonna spend based on priorities. You know, if we have a lot of construction projects, we'll put more of that labor in construction. Whereas if we don't have as much construction, they're probably gonna spend a lot more time maybe ditch cleaning or work orders, which is like culverts and tile repair, and that's a couple different items. Like one year we had, like an easy winter, a lot of times the guys will spend a lot more on brush cutting. It's something they can do in the winter if they're not busy. So snow plowing labor goes way down, brush cutting goes way up. There's not a whole lot of things we can do to save on salaries other than try and limit the overtime in snow plowing. And we've been trying to get the guys to, burn down their comp time so they have plenty of room to earn comp time back up through the winter. So we usually wouldn't see a lot of overtime except maybe later in the winter. Maybe last year we hardly paid any overtime because comp time kind of took care of all the extra time we spent plowing snow, which is not very much. So back to the original question, buildings and grounds, 20,000. I don't think we'll spend that. That seems higher than we'll use, but if we lower that number, we most likely raise the number elsewhere. Because we can't lower the amount of salaries we pay.
You can just, where they go.
Where they go. So yeah, it's kind of if you look through my budget and want to cut any numbers, the salary lines are tricky because if you lower one, you have to raise another to get enough money in there
So
to cover salary.
the other question we had was, what the heck is 7,900? And why is it not on our sheets in the service area 7?
7,900.
It's the last 5 or 6 lines.
Page 31 of the budget.
Okay. don't have your sheets in front of me, but what, is it
Well, we spent $22,000 without a budget item. We also had 6,600.
900 numbers? 900 numbers are all spread numbers. So, for instance, we have unclassified labor is something the guys will track if they are kind of downtime at the shop or driving each other to pick up vehicles or kind of odd time that doesn't fall under any category. That labor always gets spread to the other categories. So if you look at this, if you look at maybe what's total activity, all that will be zero by the end of the fiscal year and will be spread to the other categories.
Okay, so it may show up under activity now, but it will disappear later.
Right.
It's just
there will be
for your information.
There will be spread transactions, and those will automatically put those dollars in other categories. Let's see, anything else like work compensation? You know, we have however many transactions through the year, and at the end of the year, we go ahead and spread that among some other categories. And I don't have memorized exactly how that works, but specifically the unclassified labor gets proportioned back out based on the other labor categories that were used in that pay period. So let's say like mostly plowing snow, well, that's going to go back to the plowing snow category. Or if they were doing 4 different things equally, it'll get apportioned back out equally to those other labor categories. So it is kind of misleading to look at this in a mid-year scenario because all those will be zeroed out.
Okay.
So is that good enough for you to know what's going on? Okay. So your logs that you keep, just do that automatically? Or if somebody has to put it in?
Rachel has to run a manual process. I believe the setup is there, she just has to manually run it. So there's not a whole lot of mistakes that can be made as long as you, I'd have to talk to her about it. That's one of those things that I will never do that step. And Eric probably knows more about it than I do because they've done some cross training, but Becky left like a golden manual on how to do all the little tiny steps of every process. And that's one of the things that she taught her directly. So I never really got involved in that process, but I know that's how it generally works.
Okay.
Hello? Yeah, how are you? Oh, golly, if it got any better, I couldn't stand it.
We have postage
There you go. Yeah.
included in our.
Are you interested in being on that?
So I don't specifically know.
Well, Lyle Hippen didn't even know he was on it. That's how often it meets.
We're looking at a couple years of those expenses.
Well, like if they decide to run a carbon pipeline across our Winnebago County, it might happen. Now that's unlikely. But, it's just purely I guess if you're.
Recently we did that one where we sent out a bunch of stuff to.
Oh, well, there's a whole bunch of different categories. Just a second. Carla, did you have that list of? Let me see, Hasbrook is on it through Realty. Let's see. Neil Stephenson's on it as a owner operators agriculture. Here,
So if we were to add 1,000 for him, then make it 16?
You're trying to do a combined postage budget? Yeah, I can get a better number if I look at transactions.
We're kind of guesstimating on, all the offices, so
Sure.
there'll be some cushion in there.
Yeah, I mean, most of it, we don't, they just charge to us when they send out the invoice and stuff, so we don't do a whole lot of sending letters or
But we
notices.
figured you have no mass mailings or,
Really, we don't. Every now and then I'll send like a, this size envelope with some, maybe like an easement or something like that where we need originals back and forth, but boy. Other than that, it's just, we don't even send out paychecks anymore, so just sending out checks.
Well, we send out claim checks, so.
Right, so it's like we barely even touch it. Remember, we had the reclassification thing fixed that we sent out a bunch of notices on. That would be in our history, but that wouldn't be typical, so.
Hopefully we don't have that problem again.
Yeah. I think.
I should cover that.
So no?
No, I'll find someone else.
Doesn't want to take a position on eminent domain,
No, which
good grief. I'm sorry.
most of his customers and him are all gonna be on the same side of eminent domain, I would guess. It's,
But the thing is,
but
when they select the group that are gonna deal with it,
That's the
there'll be
whole
conflict
point.
in that area, so they'd be covering something over here.
oh.
So that's how you get separated.
Yeah,
But that's the whole point of choosing someone like that who has the ear of multiple people.
should eminent domain commission, what could be brought in front of them?
Well, I remember when we did the project on A42, I think there was somebody that was holding out on easement, and it came down to we didn't have to go to eminent domain. They finally agreed to a number. The other one we just noticed in 08 or 09, there was Blair Holton and somebody else over this way that I don't think it ever went to arbitration or anything. We came to an agreement. And, I mean, we don't.
I mean, we're trying to-
There's a bunch of reasons on that project. When they've been widening the road.
Yeah.
10-foot strips the whole way.
There was one holdout that I think Witt was still there here then, and
But I don't know when there's been a really big one that's come through for a really long time. I mean, like the interstate.
Put any road street people
Well, so I tell people, we aren't out to make people mad. We just, you know, we try to work with them, give them a fair value on what they need, and most people are pretty happy with that. 'Cause it's usually just an easement, when they're not actually buying it.
I don't think we had anything else for Scott, did we? We were just
No, that was the
questioning
main
those
thing.
7900s and the postage. Thank you. You're easy,
Anything
you're
else?
just easy to call.
Thanks.
Thanks.
Well, should we just approve it with everybody except for
Who's missing?
Buffalo Center?
Oh,
Just be
yeah.
done with it?
Do a
Conflict
separate,
of interest, put me in.
Actually, Lyle would just stay on it if, I mean, I don't think he,
But he's not a business owner or a
He's a-
banker.
but he's a landowner and a,
We already have one under that category.
yeah.
Josh Gray is under landowners. Can you put me on it? Is that a conflict of interest?
might be.
I'm a business owner.
How about,
And I don't have to be afraid of losing any customers.
How about a Yagi? Is
That's
there
what
a
I was
Yagi in town?
Yeah, he doesn't.
Dan lives in town. He's a business person.
ask Dan.
Can you call him? He might do it.
He doesn't care.
Well, he can piss customers off too.
That's what I mean, but he probably doesn't care.
But it wouldn't, yeah, I guess most of his customers are over there, right?
Well, he's got customers all over the place,
Yeah.
but, he's got a lot of them in Cassuth. He's got a lot of them in Minnesota. But,
I don't think anybody, like, eminent domain is not about making anybody mad, it's about finding a fair price, so it's
Yeah.
not like.
That's why I think that's the whole reason you have a banker on there. The whole
Right.
reason you have
Business people.
business people is that they probably would appreciate it because you're advocating.
Mhm.
where'd I, there.
Time to get that one off your desk. 'Cause
You have it?
Yes.
What, Dan's number?
Yeah.
I have it here. I'm just
She books to
evidently
look
not
at
getting to it here. Dan, there's the Dan. There he is. See, I went by it once.
Do you ever end up going to the doctor, Terry, or are you just self-medicating yourself?
I was doing good till this morning. I had some cough coming up. I've
Well,
been
this
taking,
cold doesn't help when that gets down in your lungs.
well, and I've been doing snowballing lately, so I wear a mask and
Yeah.
I'm all bundled up, but it doesn't seem to, it's still cold.
You're able to blow that snow? Ours was so hard.
Oh, I know, you chew a little way at a time, and
Yeah.
I was just about done yesterday. I was behind Sharon's apartment and it drift this high, you know, up against the wall and just about done, and all of a sudden the pin comes out of the
Oh, shoot.
cross PTO shaft that goes out to the chain.
Yeah, Dan, this is Bill John's fault.
Couldn't get it shut off in time.
I'm calling you. I need somebody to be on the eminent domain board that's a business person or a banker. The guy that's going off the board, didn't know he was on it. That's how often it meets. So if you would give me a call back, and let me know. Thanks, bye.
So we done with budget for now then?
I don't think there's anything too much else until I get.
Do you think we'll need to meet this week yet, or? Okay.
I don't think so. If there is something, I'll let you know, but we just gotta have time to sit down and get it done.
And get the info from others.
So if you need a day for us to come in, the only day would probably be Friday.
Yeah, I'm around, I'll be in town I have an appointment at 9 o'clock, but other than that.
For me anyway, and yeah, so.
Well, I don't think meeting to until Tuesday, but we'll see where we're at.
Narrowing it down.
That'll give you time to get everything.
Do you guys wanna make a motion on this, and then if Dan says yes, you can give me a call?
I'll make the motion.
I'll
Dan,
second it.
Dan, I could talk Dan into it better than I can Jeff. He'll do it.
Okay.
And Dan's, he has some real opinions on
Well,
carbon pipelines, so,
Let me know either way,
all right.
please, so that I can get this wrapped up.
So I
Carla's like
seconded
me,
it.
it's like, I want this off my desk. I do it at home, it's like, just let me take this off my desk. All right, where are we?
We got a vote.
What's that?
We had a motion and a second.
Oh, for what?
What were you?
Appointments to boards and committees.
Okay, and a motion by Derby, and it's a motion by Smith and a second by Derby. To make the appointments to boards and committees. All in favor, say aye.
Aye.
We stand adjourned.